This episode of The Matt Feret Show is brought to you by the Brickhouse Agency. Brickhouse is a boutique independent health insurance agency that focuses on finding the right Medicare coverage for folks across the country. Matt's wife, Nikki, is the heart behind Brickhouse. She's great at making confusing things clear and is passionate about helping people find a Medicare insurance policy that suits their individual needs. To schedule a free one-on-one appointment with Nikki or a member of her team, head on over to brickhouseagency.com or simply call 844-844-6565 and someone will help you schedule a phone call or a Zoom meeting. The consultation is free because the insurance companies pay Brickhouse, not you. There's never any pressure or obligation to enroll. Your clearer, simpler Medicare journey is just a call or click away. BrickhouseAgency.com. Not affiliated with or endorsed by the government or federal Medicare program. Contacting Brickhouse Agency, LLC will direct you to a licensed insurance agent.
Hello everyone, this is Matt Feret, author of Prepare for Medicare and Prepare for Social Security Insiders Guidebooks and online course training series. Welcome to another episode of The Matt Feret Show, where I interview insiders and experts to help light a path to successful living in midlife, retirement, and beyond.
Mitch, welcome to the show.
Thanks for having me, Matt. Really happy to be here with you finally after a few months of delay.
Yeah, no, it's been, I'm looking forward to this. So tell everybody what you do, how long you've been doing it, and how you help people.
So I am the creator of the Yass method for pain-free movement. I've been doing this for over 30 years. I developed this method of diagnosing and treating pain. I began to do that as a student in my final semester of school, in which you're suddenly having affiliations and you're treating people. And through things that happened to me, I became aware that my education did not prepare me properly to diagnose and treat. And so I became caught up in this understanding that I needed to interpret symptoms versus just accepting diagnostic testing. And that led me to understand how to properly diagnose and treat pain. And as I said, I've been doing this for 30 years. I've written 3 books on the subject. I've done a PBS special on the subject. I've treated people in 15 countries through Zoom based on this issue. And I believe that my method was given to me, or at least the desire to learn it, through a higher power. And as a result, I believe that this is here now to allow people globally to know that the answer to resolving their chronic pain exists now on Earth and can be utilized to resolve their pain and return them to full function.
I have so many questions about this topic because it is one that people, millions of people live with chronic pain. Millions of people live with episodic pain. We've all read about the addiction. We've all read about pain centers. And I want to get into all of that. But I also want to get back to what you said right at the beginning. We did have to push this off for a bit. Before I hit record, you started to talk about that. I think it's an interesting story. You want to share it?
Sure. So for people to understand about me, that this is not a career, this is not my profession, this is what I believe. I was put on a quest to understand this through a higher power. Now, when we go back to this idea of when I was in my last affiliation, when I was in my last year of school and I was doing my affiliation, you're in front of people for the first time and the physical therapist treats the person based on their education. I believe God asked me to ask a question that apparently no other physical therapist asked at the time. The person was standing in front of me and something said to ask them, could you point to where your pain is? Seems like a logical question, yet nobody seems to ask this question.
I was going to say that would not have surprised me if I.
It would seem like something logical, and yes, it's not part of the curriculum to ask the question. So what happened was when they would point to where their pain was, it was not the place that they should experience pain if the MRI identified structural abnormality was to cause pain. So if you have a meniscal tear at the knee, you should have pain on either side of your knee. But when I said point to where their pain is, it was around the kneecap. That's not the place a meniscal tear can cause pain. So by definition, that pain could not be coming from the meniscal tear. So this confounded me. So I said to myself, well, if I know that the MRI doesn't appear to be establishing the cause, then maybe I have to look at the symptoms the person is experiencing to understand what tissue is in distress. And through this process of starting to look at symptoms to identify cause, I found in more than 98% of cases, the cause of pain was muscular, which muscular causes do not show up on MRIs, which is why they remain in distress even when you have been treated based on your MRI identified structural abnormality. So for 30 years, I believe that I've been used by a higher power, and that this method that I was given to learn comes from him. Now, about 8 to 10 months ago, something happened to me, which is quite extraordinary. A tumor developed on my cheek. And so everyone can see, where is it? There's the camera. Yeah, there is my tumor.
And if you're only listening, it's, well, how would you describe that?
It is a massive tumor that basically started at my cheek and covered my entire right ear. It was circular, and it was so big that basically between the edge of the tumor and the side of my ear, I could not even get a Q-tip in between it. That's how big it was. Okay? So now the process begins of how to address this, and I'm told to go to the Mayo Clinic, and I'm told that they can't tell if this tumor has entered the external canal of my ear, so therefore that is perceived that my ear is cancerous, so they're going to take my ear and the tumor. 2 weeks before the surgery is scheduled, which is November 9th at the Mayo Clinic, I am trying to process this. Why, God, would you give me this tumor? Because I believe that everything happens because it's supposed to happen, and everything is, as he commands it. So I'm assuming there's a lesson to be learned. And over a 3-day period of thinking about this, it comes to my thought process that what's happening is, I'm not going to deny, throughout even 25 years or almost 30 years of this, I've questioned, why would I be the one chosen to take on such an incredible burden as the person who's supposed to end chronic pain? And I've gone through a lot of traumatic events in my life through this process. I've gone bankrupt, divorced, lost a decade with my child. So it caused questions as a human being. I believe what I heard for 3 days was God saying, I am going to now make the world know that this method exists in the coming months. And I could not have you questioning whether, in fact, you are the arm of me and that you are there to make this be available globally to people as they need it. So I needed to you to get my attention. So we put the tumor there.
That's quite a way to get attention. Yeah,
exactly. And so for 3 days, I thought about it. And finally, after 3 days, it was, to me, I can only say that is as clear a message as I got. I felt absolutely sure that's what he was saying to me. And so I finally succumbed and submitted and said, I promise you, I will never, ever, ever question you again. I am your arm. Whatever happens going forward, no matter what kind of work is involved, no matter how strenuous this seems, I am in for the long run. I am your arm. We will resolve chronic pain through this method. And the tumor began to shrink. And what happened was I had a client here, and he said, Mitch, I think the tumor shrunk. And I'm like, it's impossible. I mean, I think you're being nice because there's no such thing as a tumor like that shrinking. Right. But after he said it, I started every day looking in the mirror, and I could see more and more of my ear. And I was so screwed up mentally and traumatized from this, I thought that the tumor was making my ear grow. And really what I was seeing wasn't the tumor shrinking, but my ear growing. For at least 2 or 3 days, I literally was so mentally distorted.
Sure.
And then I continue to see, no, this is really getting smaller. And then this is called the tragus. For the first time, I see it. So now we are 3 days before surgery. I try to call the surgeon. He doesn't get back to me. I contact the oncologist. He said, come in immediately tomorrow. We get a PET scan. He starts measuring. He's like, absolutely, you are correct. It is shrinking. And he said, as far as I'm concerned, what I think happened is somehow, for whatever reason, the blood supply died, and therefore the tumor is shrinking. He said, I would suggest to you, don't get the surgery. Let's go another 4 weeks. We'll do another PET scan, and we'll see. So this is now about 6-8 weeks since, and I can show everybody, if they can, who's ever seen,
Yep.
and Matt saw it, you can see that the tumor is gone, basically. There's a little bit of skin variation, but basically that tumor is 100% gone.
Yep, I see it.
And my oncologist keeps looking at me and saying, what did you do? What treatment do you use? As if I would do chemotherapy or radiation behind his back, which would be lunatic. I mean, how crazy could that possibly be?
He thinks you flew to Belize. And
Exactly.
Yeah.
So I basically just say the same thing I say every time. God did it. Now I've been there a second time, and he brings his entire staff in because now I'm a complete oddity. So now he brings his whole staff in and is like, everybody, come in. Look at his face. And everybody knows of the tumor. They'd seen the pictures. All right, Mitch, tell him what you did. And I just say, God. And they all, no radiation, no chemotherapy. You did no treatment. I'm like, I swear to you, I promise you, this was God. So I feel a very, very strong affinity to God in a way that's even greater than I felt prior. And because I promised him, you can't go back on your promise to God, I now never question. I am prepared mentally. I've actually got a certification prepared anyway, but as awareness develops, I am ready to certify people and have this made available. So as the demand grows, we will have the proper number of practitioners, and everyone who seeks this, who is in chronic pain, will have this ability to resolve their pain. And we will do as God has asked me, and we will end the chronic pain epidemic.
Well, before we move into that chronic pain epidemic, let me just first say I don't know how to respond to a miracle. Because it sounds like a miracle to me, and I've never gotten into religion on this show. But you called it a miracle. Who am I to disagree with that? That's amazing. If for those of you that didn't see the picture, if you're just listening, we're not talking a little melanoma here on the forehead. This is what would you call that? 2 inches thick, 3-4 inches.
Yeah, I believe it actually was. Yeah. It was actually close to 3 inches thick. It was 2.8 something thick. Yeah. And it was something like 3-inch diameter, I would imagine.
It looked like the size of a biscuit.
Yeah. Like if I was wearing a earmuff, it looked like an earmuff.
Very good. It looked like some of the headphones I've got on right now.
Yes.
Yep.
So
crazy. Well, I'm glad you're here. I'm glad we're doing this.
Yes, I am too.
More importantly than anything, I'm glad you're recovered or on the path or somewhere there. I'm glad you are tumor free. That's amazing.
Thank you. Appreciate it.
I don't know how to follow that up with chronic pain, but let's try.
Yeah.
A miracle.
I mean, hopefully,
let's talk about chronic pain.
I mean, to be honest, I hope so. I need people to believe there's an alternative. I need people to be willing to go beyond the cultural bias that the MRI is correct and that surgery is needed every time it finds some structural variation. And I'll be very honest with you. If it means talking about a tumor and somehow I'm the one guy who miraculously had it disappeared, that maybe people question, maybe there's something to this guy and we should listen to him, so be it. Trust me, I'm all good with it. Yep. Whatever has to happen, I'm here. I want to be a part of this and help anybody possible so that they could have the life they choose. So maybe that's what it's there for.
Yep, and let's jump into it. So chronic pain, tell me about your method. Tell me about how your approach has evolved over the years and where you are today.
Sure. So let's just give a little history of chronic pain, because it's now been 40 years and people don't realize that prior to those 40 years, which is the mid to late 1980s, chronic pain never existed in the history of mankind. This is where people first have to understand that something different happened in the mid to late 1980s. So you go back to the Roman period, the Greek period, any other time in American history, chronic pain has never existed. Okay. So what happened in the
chronic pain? Do you mean chronic like joint pain? Do you mean like rheumatoid arthritis? Pain from injury that never got repaired, or like how do you mean like pain's never been chronic pain wasn't a thing until the 80s?
So when we talk about chronic pain, the separation between acute pain and chronic pain, acute pain that runs greater than 3 to 6 months is now called chronic pain. Okay, so that's the only difference, is the time frame. Now, there were people who have had pain due to injury, any of the things you described, but you can't talk about half the world's population having pain that's greater than acute until the mid to late 1980s. Certainly an older population, after they retired, maybe had pain. Maybe some small group had rheumatoid arthritis. But when we talk about the issue of chronic pain today, you're talking 130 to 140 million Americans, 1 out of every 3, and roughly 1 out of every 7 people in the world, 1 billion people suffering from chronic pain, meaning pain that has been experienced greater than 3 to 6 months. That has never happened in the history of mankind. So you might have had small pockets here, not the population, not the general population.
Is that due to the increase in chronic pain, or is that due to the increase in the monitoring and the surveying of chronic pain?
It's due to one primary concept: the advent of automation, technology, computers, phones. So what happened was, if you look prior to the mid to late 1980s, 99% of the population were doing manual, multi-directional jobs, occupations. So I'm not sure, you look a bit younger than me, but if I was younger and I wanted to go out and play with my friends, we went out and we played flat tag football. Now, if I'm a kid, I play John Madden football. I don't go out, right? You can see different. So I'll give you like another example. So if I was a farmer, I would have to go on my tractor and I would have to look at all the irrigation pipes and look for any breaks in sprinkler heads so that my crops would get watered properly. Now there are sensors and I sit on my ass looking at a computer screen which sends a red flag if a sprinkler head breaks, right? So you could look at, so what's the number one job today? IT, right? So what percentage of the population is doing something associated with the computer beyond information technology? What about social media? What about creating platforms, advertising, all this stuff? A vast majority of population now is somehow integrated into the computer. The way people get information. You used to go to the library and look up books. There is no more library. You got it all on your computer. Okay?
Yep.
That all occurred. That vast change in social culture happened in the mid to late 1980s. So all of a sudden, you have this massive population. Before, it was just retired people, right? They would sit on the rocking chair, on the porch. They went from very active to not. Those people had pain, and they were told it was rheumatism, but it wasn't. It was actual muscle weakness. They just didn't know it, okay? Now you have your 20-year-old IT person who sits at his desk for 10 or her desk from 10 to 12 hours a day. What they don't realize is they just became that retired 90-year-old person in terms of the strength of appropriate muscles that allow you to perform manual activity, normal, going to the bathroom, walking up a flight of stairs, kneeling down, doing any activity, playing tennis, pickleball, anything like that. If you don't use muscles, they weaken. Even if you try to strengthen them, if you don't use them, they weaken. So there are 2 primary muscle groups, the gluteus maximus, which is your butt muscle, which helps you stand upright, and the gluteus medius muscle, which gives you balance side to side. Those are the muscles most apt to lose strength from sitting. They're also the muscles most associated with activity. So here you have weakness developing. So when people then do decide to do activity, they strain and elicit pain. So the chronic pain epidemic begins in the mid to late 1980s as an acute epidemic. There is an influx of people. Before it was 80 and 90-year-olds, now 20s to 90-year-olds are now seeking care for this pain that suddenly everyone's happening at the neck, at the shoulder, at the back, the knee. What made it become chronic? What was part of that automation that developed in the medical field? The MRI. Mm-hmm. Now, for most people, and I'm sure you don't know this, the MRI was developed, the technology was developed to find tumors in the brain. That's what it was. Go back, anyone can look up the history. What was the MRI developed for? To find tumors in the brain. So, think about it. It's $1 million a machine to build. And what percentage of the population actually present with some sort of symptoms that would warrant you saying, maybe I have a tumor in the brain, you should go get an MRI? Yeah, it's not many.
Not many. Okay?
So I don't know who and I don't know how some magical situation arises where a secondary usage is provided. That suddenly the MRI, you've got this massive influx of people who are now complaining of pain. Well, we could use the MRI to identify the cause. And it starts identifying herniated discs, arthritis, pinched nerves, meniscal tears. And since that's found where the pain is experienced, it is asserted to be the cause of the pain and begins to be treated. So now you have people who are being treated based on structural abnormalities identified on the MRI. Now, whether it's surgery or any other thing, surprisingly, with all this treatment, no one's pain is decreasing. In fact, for many people, it's increasing. And it's increasing beyond 3 to 6 months. So now we have this massive influx of people who are now having chronic pain. We shift now to the early 1990s, and now we have this massive amount of people who have chronic pain, and we're trying to use the methodology that we were told should identify the cause and resolve it, and it's not happening. We have to go into a different direction. Since we can't identify the cause and resolve the cause, we need to start looking at ways to mask their symptoms. Okay. Lo and behold, opioids are developed.
Oh, gotcha. Okay. So instead of the physical therapy, instead of the muscle balance, they did that, but also added in on painkillers.
So they were physical. So what I do is, it's important to understand, I'll explain the differentiation. What I do is not physical therapy, although it's muscle-based. Physical therapy is part of the medical system. When you go to a physical therapist, you go based on a referring physician's referral. That is typically an orthopedist or neurologist. They got that referral and that diagnosis from the MRI. So you're seeing the physical therapist based on the MRI finding of a structural abnormality. So they're attempting to treat you for a structural abnormality, which really doesn't make any sense anyway. But that's why that treatment typically will never work. Because they're trying to say, oh, I'm treating you for a herniated disc. Well, how could you make a herniated disc unherniated unless you surgically repair it, right? Mm-hmm. If you have a meniscal tear and meniscal tears cause pain, well, you would have to do surgery to make it not be torn. So going to the physical therapist actually reinforces why that person still has pain and kind of is the adjunct to pushing them towards a surgery they never need. So that got us to the mid 90s, which is where you now have your opioid epidemic. And everybody, there's been a bunch of miniseries about Purdue, the company that made it, and how evil they were. But Matt, let's think about it a second. I make a gazillion painkiller pills. I now say, okay, for me to make money, I need people to take it. So I go to people and I say, here's a painkiller. But if nobody had chronic pain, wouldn't they say, screw you, I'm not taking your pill. I don't have pain, so why would you give me a painkiller? So what you need to understand is that the opioid epidemic would have never existed without the chronic pain epidemic. That's what everyone has to recognize.
Yeah, because it has to be prescribed, right?
You have to have a demand before you can give a supply, right? You have to have developed the demand. But what you want to understand is why does the government and society allow them to go after Purdue? It's a perfect scapegoat, because if you really went after who the cause is, whoever allowed the MRI to be falsely presented as an ability to identify the cause of pain, then you're talking about a third of the population has a case. A third of the population of the United States, out of every 7 people, could say, I'm in chronic pain because you misdiagnosed me, because you used a technology that was never going to be able to identify my cause. You know how many? I treated hundreds of people who were suicidal from pain, came into my office and said, I'm putting a bullet in my head. I'm telling you now, this is how this part is why I became a little wacky, was People literally stood in front of me and said, I'm putting a bullet in my head. I have been on earth. I've lost my family, my job. I have no reason to be here anymore. If you can't fix this, I'm better off out. And so
that's not something I run into every day.
It's highly unusual, and I can assure you I'm probably one of the few people who have actually treated hundreds of them. On my website, I'm on my my YouTube page, Dr. Mitchell Yass, there is actually a video of Kathy Sweeney, and she's straight out telling you she was going to off herself, and she had a young 5 or 6 year old child. She was married. She couldn't take it anymore. And I was her last resort, and sure enough, she's perfect. Everything's all good. But imagine worldwide how many millions of people have committed suicide because they just couldn't take it. How many people are now on antidepressants because they're so depressed from their pain that they can't live? But the medical system can't see what to do about it because they can't establish why they're having that pain, right? They've done everything right. So that's kind of where we find ourselves. Lots of people having sustained pain, being told that they've done all the appropriate treatments, that the diagnoses are correct, and finally, you kind of fall into a couple of camps. Either you're told stay on pain management for the rest of your life, which is kind of scary for a lot of people.
I have a friend whose brother is basically that.
Yeah, it's pretty scary.
I listen to him and I go, how? I'm no doctor and I'm no pharmacist, but I know how many pain pills, a number more than one is a lot.
Yeah.
But he's in that category. Go ahead.
And by the way, I want to make sure that no one's confusing this. When we say pain management or opioids, we're talking heroin. Let's not be confusing. Let's not parse words. Opioids, opium. It is a form. Heroin, morphine. It's all the same thing. You're giving people, even in their 80s, all the way down to their teens, you are giving people heroin. So don't be surprised how addictive it is, right? So that's one camp. The next camp is those who will not take that, and they are told you're going to have to live with the pain for the rest of your life. And then the final group is kind of morbid and scary to think. They're going to tell those people, there's nothing wrong with you. Your pain's in your head. Which is so disingenuous. I have worked with so many people who have been told that. Just look into their eyes. Do these seem like these are crazy people? They would give their left arm to be out of pain. They want their families back. They want their lives back. I have had people have breakdowns, emotional breakdowns in front of me. This is real to them. This is not in their head. And because I understand how to listen to their symptoms and interpret what tissues in distress, I reaffirm to them, yes, this is real. This is not in your head. This is really your body with a tissue in distress, eliciting that emergency distress signal of pain. And you just have to figure that tissue out, establish how to resolve that distress of that tissue, and boom, your pain will go away. And that's kind of what this method is all about. So talk to me about the method. How is it unique? Sure.
What do you do without giving away your
Sure.
secret sauce, I guess? But how is yours unique? How do you approach things?
So I think the best way to do this is let's go with different body parts. And I'll explain how I do what I do versus how they do what they do. And then you could see where the ending would be and which ending you think the average person would prefer to be on.
Okay? Yeah.
So We'll do it that way. Here's a classic. I have pain here. This is where my pain is.
You get it do the audio. Tell people where you're pointing. I can see.
Oh, I'm sorry. So I'm pressing in my upper trap region, my neck.
Yep.
I'm talking about pain on both sides of my neck. And it impedes me from doing my work on the computer, or I can't read. If I stand too long, I get pain. And it makes it so that I have to lay down immediately and I have to take pain medication. And it's just impeding my ability to function. Okay. What would happen with that person if they went to a doctor? They're going to get an MRI. The MRI, the high probability is that it's going to show some sort of variation in structure at the cervical spine, a herniated disc, stenosis, which that term just means narrowing. The space between two vertebrae has gotten narrower, or a pinched nerve. It's not a nerve, by the way. At every level of the spine, nerve roots come out. Nerve roots form nerves away from the spine. That's important to understand. So if someone's saying that you have a pinched nerve, that's 100% fallacy. It's just impossible. There's no nerve that attaches to the spine. Nerve roots come out, okay? So they're going to find a herniated disc, a stenosis, or a pinched nerve, and this is the game. You had your pain, then you get the MRI. The MRI is obviously never performed before your pain. So you're going in with pain, some sort of pain. They find the herniated disc, and because the herniated disc is found for the first time at the time of your pain, it is asserted to be the cause of your pain.
Well, I mean, it seems kind of logical, doesn't it? I guess.
Well, that is
I
unless
wouldn't necessarily question that if I, I'm listening to you, right, and I'm going like, well, I don't know if I had really chronic pain in my neck. Doc says, I don't know, let's get some X-ray or some MRI on it. Seems reasonable. Oh, look, you're gonna pinch nerve. Let's cause the pain. Let's fix the pinched nerve. I'm following, right? We're both following.
Right.
It seems
right.
I guess from my bias and my background, seems okay. Nobody's going like, what you got to do, Matt? You ought to fly to Belize. And you ought to get traction, 1,000 feet underwater. I mean, so far it doesn't sound crazy, right?
Right. So now let's start to break it down. So what they're doing is they're using something called correlative theory or junk science. I'm going to teach you this from a science perspective.
Sure.
What they're saying is that if something happens at the same time as something, I can say that one thing causes that. That's called correlative theory or junk science. It's the equivalent of saying if I open my front door when the sun rises, I could say opening my front door causes the sun to rise. So I can bring you to my front door, and every day I'm going to open that front door and you're going to see the sun rise. And after 6 months, you're going to say, wow, that guy's got incredible power. He makes the sun rise by opening his front door. But you would laugh and you would say, well, clearly that's illogical. That is the general theory being used. So here's the next question for you. You said you think, well, that sounds logical. So here's a question for you. Do you know or don't know whether that herniated disc was there before your neck pain began? Do you know that?
Clue.
Or not?
No clue. Nope.
So you don't know that.
Nope.
So have they proven that herniated disc began at the time of your pain? Because if that is the cause of your pain, the pain begins at inception of the stress of the tissue. So you have to assume that if your pain began 3 weeks ago, that herniated disc would have had to have happened 3 weeks ago.
Okay, I'm following.
But you don't know that because no one ever proved that to you.
No, because no one routinely gets a random MRI.
That is correct.
Just to check my spine out, right?
Correct. So that's your first problem with the logic, is that there's no confirmation that it may have been there before. So that's a problem. And that's something I would strongly want you to think about, because if it was there before, it couldn't be causing your pain. All right, let's take the next form of logic. If I tell you herniated disc cause your pain, what would you expect to find in people who don't have pain?
No herniated discs.
No herniated discs. 1994, the first study performed on people with no back pain showed 70% of the population have bulging or herniated discs. 70%. The conclusion of the study was that, in fact, positive findings on MRIs are typically independent variables having nothing to do with the cause. That's 1994.
I don't think I've heard that before.
Yeah, I can show it. I can actually show you the study. It's been around forever. It's been written up and it's always been used. So remember that. So right now, based on what I just told you, if herniated disc cause pain and people who don't have pain have herniated disc to the level of 70%, how could you say your disc is causing your pain? That should put that into a massive level of confusion and questioning. All right, here's the last piece of the puzzle. I just said your pain is running down your upper trap region. They're telling you it's coming from your spine. Based on what they said, if you want to incite or make your symptom worse, you have to press on the cause. Where should you have to press to make that worse if it's coming from a herniated disc?
The herniated disc?
Correct, on your spine. So I can have anybody on the planet press on their spine from here to eternity, and they're not going to be able to shoot it down their upper traps. But if I take my thumbs and push into their upper traps, I'm going to make them scream to all hell. Okay? So what I did was I pressed on the spot where the pain is, and I created their pain. That is known as point tender pain, meaning the tissue I'm pressing on is clearly the tissue creating it. So by proving that your pain is point tender, I just proved it isn't referred, and therefore it couldn't be from the disc. The actual presentation of your symptom has just proven it couldn't be from your disc. It's absolute. So what that shows is that that disc has probably been there before and, in fact, is independent to the cause of your pain. So I just proved by interpreting your symptoms and knowing logic that what they told you was completely false.
Unless, of course, then you treat the pain and the pain persists. Then it could, right? It could actually be that it is causing the pain. So if your attempts to relieve the pain are unsuccessful, then what?
Well, let's talk about their attempt.
That's where you start.
Yeah, let's talk about their attempt to resolve your pain. So what are they going to do? They're going to give you an epidural nerve block. And they're going to play a game with you, a game. They're going to say, so if we give you an epidural nerve block and you don't feel pain, that proves that the pain was that disc, and now we're going to want to do surgery. You're missing a little problem with the concept of the epidural nerve block. Do you know what's given to a woman who's having a pregnancy who can't take pain? Oh, that's right. It's an epidural nerve block, and it makes her not feel pain. So are you saying the cause of pain of pregnancy is a herniated disc? The pregnant woman isn't feeling because there's this huge thing coming through a vagina that, in fact, it's actually a herniated disc? That's what you want me to believe? That doesn't sound right to me. So what you understand is that an epidural nerve block blocks pain of any tissue below the level that it's given. That's the reality of it. So that's probably a lie, what they told you that you had your pain. You could have been muscle. It could have been a nerve. It could have been anything. But since it blocks symptoms below that, you just don't feel it. So that's not a good answer. And by the way, all medications cycle through your circulatory system and are ultimately brought to the liver and destroyed and eliminated. So anytime they try to give you a medication or a nerve block or something of that nature, at some point it's going to wear off. That's when the person suddenly realizes, oh my God, my pain is back and it may be worse than ever. So that's their first attempt to address it. Then they'll try chiropractic, physical therapy, and all these other conservative things, and you still have that pain in the upper trap. And finally, they're going to play the game with you, the surgery as a last resort. Now, if you understand psychology, you would realize that's called coercion. I didn't theoretically and scientifically prove to you that the cause of your pain was from that disc, and therefore you should get surgery. I played a game with you, and I said, look, I'm a good guy. I don't really want to do surgery with you, but I'll try all this other stuff. And if it doesn't work, though, you're going to have to agree that you're going to get surgery because it's my last resort. And I coerce you into getting a surgery you never agreed to. You just did it because you were coerced into it. That's why most surgeries are performed. Coercion.
Do you think it's overt coercion, or do you think it's just the medical training, or both?
It's a combination. It is basically education and what do you expect this guy to say or this woman to say? This is what they do for a living. So what has always been my concern is the fact that the failure rate for back surgery is somewhere around 70-80%. So my question to the surgeon is, how do you keep sending people for surgery when 70-80% of the population keep coming back to you and saying, hey, I'm no better, if not worse? So, but that's a separate issue. This is me, that's them. They got to deal with that.
I'm trying to make sure that, we're not saying all doctors are pushing surgery in a dishonest.
No. They're doing as they are trained, irrefutably. By the way, there is also the issue of liability, and I've talked to doctors about this, and if what is considered standard of care is to get an MRI, then they're going to do it every time, because if they don't and something goes wrong, they could be sued. So there's also the issue of liability. You got to do standard of care. And if you have pain in your neck or your back or your knee, standard of care, get an MRI. Okay? So that would be what would happen to you. So eventually, maybe you get 2 or 3 back and cervical fusions. And by the way, cervical fusions are now done from the front. So they're going to have to get rid of your esophagus and everything else. And it's horrible. And every person I've ever seen who has cervical fusion from the front, I say, turn your head. This is how they turn their head after the surgery. This is how they turn their head after the surgery. Not good. The results are not good. So if you came to me, I would say,
okay. Exactly where I was going to go. Okay. Right. So now let's go to you.
Good.
So go to you.
Yeah. So now we have this upper trap pain. And what I noticed about you, you described, and here's a big one. If it was a herniated disc, that is considered a structural abnormality. If you had a kidney stone, would that be intermittent pain or would that be continuous pain regardless of your position, action, or anything else? It would be continuous.
Yeah, I was going to say, I haven't had one, thank God, yet. So
right.
I think
it's continuous.
But I'm not sure.
Right. You have palpitation of your heart. Does it matter what position you're in? Does it matter whether you're sitting, standing, or is it going to be continuous? It's continuous. So what you start to understand are structural abnormalities create continuous symptoms that vary very little in their intensity. You just told me that your pain is when you're sitting, standing, but if you lay down or you get into a recliner, my pain goes away. That's interesting. That sounds more like it's activity-based. Some activity is created not by your kidney, not by your spleen, not by your liver, but I think it's muscle.
Right.
So the description of what brings your symptom on and makes it go away, you just reinforced irrefutably right off the bat with that one question. It's muscular. Okay? So I know it's muscular. Now I'm going to look at you from the side and I'm going to see that this is how you stand and everything else. So you have an alteration in your posture. What I was presenting to Matt was that your head is forward and your rounded shoulder. Very, very common with that area of pain. So what I see is that you have altered posture. So it looks like you have an activity-based problem, which is muscular, and you have change in posture. Posture is the culmination of the pulls of muscles. Good posture, strength and balance. Bad posture, weakness or an imbalance. So what I start to do is put 2 and 2 together and realize that why you're having pain here in the upper trap region is because your chest muscles, your front shoulders and biceps are stronger than the upper back, the back shoulder, and tricep. And as a result, they've shortened and rounded your back, rounded your shoulders and drawn your head forward. What that does to the muscles that supports your head actually causes their connection from the shoulder to move farther away from the spine. That changes the length of the muscle and it loses its ability to create force, so it strains and elicits pain. So you have a postural variation caused by an imbalance of muscle between the front of the upper body and the back. So if you came to Mitchell Yass and got the Yass method, there'd be a little massage of the pecs, massage of some of the muscles in the upper back region. You would start a series of 4 to 5 exercises. On your first session, at completion, you would see 80 to 100% reduction in symptom, and your posture would be dead vertical. Your ear, your shoulder would be directly over your hip, and you would say, I don't understand. How'd you make that go away so fast? And that would be it. Okay.
That sounds simple, but it's not.
When you understand the principle, it is actually quite simple. It's pure logic. I was taught logical analysis as a boy. I was taught to be a logician, and that's how I developed this method, was analyzing things and then putting the appropriate processes together. So here's.
Why is it that your system is so unique in that? I mean, I know what you were saying earlier. There's a legal component. There's a training component. There's a normalization of pop a pill. I get all that, but in terms of the actual process and progress, why is yours not done everywhere? Why is yours so unique?
So I'm going to say something, and this is going to really kind of upset people, but it is the reality. Everything you said is true, but there's one more factor. one more factor that makes the existing system, which fails so miserably, allowed to continue to progress. And that is that the medical system is a fee-for-service basis. What that is to say is that outcome is not a factor in payment. So if you go to a restaurant, you ask for a perfect steak and they char it, you walk out the door and you don't pay. If you go to the mechanic and you say, fix my engine, you turn the key on and it doesn't start, you don't pay. You have pain in the upper trap region, you get a 5-level cervical fusion, your pain is worse after than before, they get their $350,000.
Yep. Fee for service.
So
that I am aware of. And of course, there are efforts and have been to change that.
Sure. But that is
outcomes based. Yep.
That is a huge factor. I want people to understand this. They go to the physical therapist. They give you a page of 6 stretches to do or something. By the time you finish, you see that you could do the very same thing at home as you're doing there. So you're like, why am I going there? Why am I signing this sheet? And the reality is that as long as they get paid for you to go there and do the same thing you're doing I just want someone to explain to me, what is the incentive for that to change if the outcome is not associated with payment? Why should they? Tell me why they should change.
I get it. It's fee for service. That's what it is. You said it. Yeah. It's fee for service.
And it's the entire medical system. So when people say, your question is such a valuable question because everyone says the same thing to me. My God, you've got the answer to resolving pain. Why isn't I love when people, why aren't more physical therapists doing this? Well, if I got paid to put a hot pack on your back and make you go onto a bicycle for 3 minutes and walk out the door and get paid versus having to have the understanding as to how to properly diagnose what tissue is in distress, which is unbelievably complex to do this, figure out its muscle and then know which muscles and how to strengthen them and get that person out of pain, then teach that person how to take the responsibility and do it accurately so they can then be in control of the situation. I think you'll take the hot pack and bicycle as long as you get paid.
What are you what are you doing to I know what you said, you spread the word. And then in the beginning, right? When we were talking about your miracle, I'll call it that. It's a miracle. Yeah. We were talking about your miracle. And your mission is to double back down on what you've been doing for 30 years and get this out. What do you want to do? What do you want the people listening? What do you want them to know? Do you want them to be, active in their healthcare and question authority, question their doctors, seek you out, seek someone like you out, not be afraid of other opinions? Like, how should people listening right now go, okay, interesting story. I don't know where where his clinic is. Maybe I can't get to him. I don't know if he's good, bad, otherwise. How do I check them out? What do you want people to do? What's your ask for the people listening right now, or your advice?
So let's just hit what you talked about very briefly. I am located in Jacksonville, Florida. That is where my facility is. But if you can't get here, people should know since 2015, when I did my PBS special, I've been doing Zoom sessions, and I can have the same effects, whether in Zoom or in person. I've treated people in more than 15 countries using this method. It is highly effective. You don't have to worry about whether you need to see me in person or not. It's simply not true. Now, there are certain things I want people to start saying. You're on your 5th revision of your hip replacement. Can you please start to say to yourself, maybe this person doesn't know what they're talking about? Can we finally start taking responsibility as human beings? I understand you don't have a medical degree. I don't need you to have a medical degree. I just need you to have a little bit of logic. You went to the chiropractor. You're on your 57th adjustment. You're 6 months in and you're still having the same pain. Can you finally say to yourself, maybe, listen, we're not disparaging the individual. I'm sure they're very nice people. I'm sure these people would love to be helping people, but their education hasn't allowed that to happen. That doesn't mean you should give up all your money and lose your life because you can't hold your head up. You need to be responsible. So that is the first thing I say to people. Be responsible. And what I want people to do, this is where it comes from. If someone says they're going to treat you, You can't accept that treatment unless they say, I know what tissue's in distress, and they got to be able to show this to you. I know this based on the presentation of your symptoms, and this is exactly what I'm going to do to resolve the distress of that tissue. If someone gives you that narrative, get the treatment. If someone can't give you that narrative and just says, see, MD or chiropractor, see, believe me, if I was you, I'd walk out that door, because that's a red flag. They don't know what they're talking about. Let me make this clear to you. I've been on PBS. I've done lots of stuff. My third book is translated into Chinese. I got plenty of credentials. I'm telling you now, don't believe me because Mitchell Yass said it. I want you to listen to what I'm saying and realize, is this logical? If it's logical, that's what you should follow. So just realize I hold myself to the same level I hold everybody else. Okay? The other big thing that you have to really come to right away is look at your symptoms. Someone's trying to tell you that it's a structural abnormality. You better be coming back with me and saying, oh, my pain is very consistent and it's roughly 24 hours a day, 7 days a week. And it doesn't really matter where I am, standing, sitting, or doing anything. But if you say that your symptom is incited by activity, and when you stop the activity diminish, you just acknowledged your problem is muscle. Now, you could say to yourself, so how come no doctor has identified that to me? Why did the chiropractor or the physical therapist identify that to me? Here's the great lesson to learn. Muscular causes don't show up on MRI. So remember I told you about that strained upper trap? Show me the picture that shows the muscle strained. You have pain at your kneecap, and it's because your quadricep, your front thigh muscle, is shortened and it's pulling excessively, so your kneecap doesn't glide properly. Where's the MRI showing a shortened quad? Your glute med on one side is stronger than the other, and it's causing your pelvis to be unbalanced and higher, and that's leading to pain in your back or somewhere. Where's the imbalanced glute med, gluteus medius muscles? Where's that show up? It doesn't. So if you're seeking care within the medical system and you have a muscular cause, it's pretty much impossible for that to be identified. Mitchell Yass is telling you over 30 years and 17 to 18,000 people I've treated, I have shown that in more than 98% of cases, the cause of pain of people I've treated is muscular, even when they all showed up with their MRI structural abnormalities. So it's such a different understanding. If someone's going to say to me, you think what you're saying is a little odd? Of course I know it's odd. I've been dealing with this for 30 years. I've been trying to create awareness for 30 years, and it's a war. But it's a war worth fighting, man. Fighting. These people are sitting there. Everybody knows someone who's had a failed surgery. Everybody knows someone who's stopped playing golf or tennis because they can't. Everyone knows someone who's lost that job because they can't. Unfortunately, a lot of people know people who become divorced or lost relationships with kids because they can't function. You know how many 60, 70, or 80-year-olds have said to me, you have no understanding of what it's like that I can't get down on the floor and play with my grandchild. You have no idea how disheartening that is to me. That's disgusting that can happen. This is 2024. But that's what's out there, and there's got to be a reason. And for the average person, they only see themselves in their chronic pain. See, they don't realize that they are part of hundreds of millions of others. And that, in fact, with that understanding, it shows there's something systemic going on. And so I'm out there and I'm plugging away. I have a YouTube channel, Dr. Mitchell Yass. It has 340 videos, something like that. You could go into the search, pick anything from headache to plantar fasciitis, and I'm going to tell you about it. I'm going to give it to you in the average person, lay personese, so you could understand this. And, you know, if it starts to make sense and you want to seek the care, you could obviously go to my website. Just so everyone knows, my website is Live Without Pains. It's plural, livewithoutpains.com. There's a schedule now button if you want to schedule a session, or there's a contact us button, which goes directly to my email. My email is drmitch@mitchellyass.com. You could reach me that way. It's very important to understand. So if you were to go on and you Google Dr. Mitchell Yass, you're going to get 30 pages. It's going to look like this guy has instituted this in all countries and stuff. It's not true. I'm a singular guy. People have called me and said, could I get Dr. Yass's assistant, or could I speak to the administrator regarding insurances? And I'll be like, it's me. Like, I'm talking to Dr. Yass, and I'm like, yeah, it's me. That's my cell phone.
I think I read recently Susie Orman. It's like her. Like, that's
right.
It. She doesn't have a team of like 200 people behind her. It's just her.
Yeah.
Yeah.
It's wonderful to be that person. And, you want to have accessibility. And my point is that if you seek me through phone, email, or text, I promise you are getting a response. Nobody, remember what I said, very important to understand. I am being used by God. My responsibility is I used to think to myself, I got this understanding, and now my job is to go out and seek people to get this method to them, for them. It's just the opposite. You got 40 years of hundreds of millions of people in pain seeking. I need to be there for them. They're out seeking me. So when they seek me, I have no choice but to make sure they get the information they need. So that's kind of my general premise on how I think people should start thinking about their pain and what they can do to take responsibility and see maybe those guys aren't so great at resolving pain, and maybe there is an alternative that's outside the realm of the norm.
Dr. Mitch, this has been great. We could talk about this for a long time, because we didn't even get into the whole like pain management piece. And I guess we kind of did. We walked around it, but without going on for another hour, let me ask my wrap question, which is, what about pain, and specifically about you and the way you do things, did we not cover that we should have?
Well, I kind of want to just briefly talk about what you're talking about. So in the 90s, what happened was they developed these facilities called pain management facilities.
Yeah, you said Florida, and I immediately went, pain management centers.
Sure. And I mean, there were other places where West Virginia was the place where it was kind of supposedly the epicenter of the opioid epidemic. Yeah. But I want people to understand very carefully, there are these places popping up now all over the place. And they're called spine and pain facilities. They're everywhere now. Don't be confused. That sounds very classy, very professional. That's just code for pain management. That's just code for pain management. If you go to a spine and pain facility, you're getting epidural nerve blocks, opioids. There's something called radiofrequency ablation, which is cauterizing your nerves, which is completely medieval. I mean, that is medieval stuff, but it's happening out there. So if someone in a professional light is trying to convince you the best that could be done for you is some form of pain management, you must understand that is the medical system putting the white flag up. They're raising the white flag to you, and they're saying, we give up. We don't know how to find the cause of your pain. At best we could do is mask your symptoms, and in them trying to mask it without establishing cause, you better understand you're looking at pain indefinitely. So you need to, if that's where you are, you've got to take it upon yourself to step back and say to yourself, well, let me see if I could find somebody who is in a position to establish cause, what tissues in distress, and resolve it. So that would be my answer to that. Don't accept pain. Pain management is fine in the short term while you're trying to establish cause and resolve it. But if you're not establishing cause, you're just basically leaving that person in this kind of dead zone where you're just trying to minimize their symptoms. And by the way, the anxiety associated with that going on creates much worse problems than the pain itself. Anxiety that develops and hopelessness and all that stuff that comes from sustained pain is much worse than the pain itself. So people need to understand, if it was me, I would not accept the idea of someone saying, okay, we're just going to try to modulate how severe the pain you experience is, but that's it for now. That's all we can do. Find someone who knows how to establish cause and resolve it. And that's the Yass method for pain-free movement.
Dr. Mitch, thank you very much for doing this. And I'll put up all the links on the website. I'll put up all the links on the show notes. And going back to the beginning of this, I'm glad we're doing this. And I'm glad we're able to do this. And it's a pretty amazing story, what's gone on in your life the last couple of months. And Godspeed, my friend. I'm really glad you're here. What a miracle. And thanks for sharing your message with us.
I just want people to understand. We were supposed to do this a few months ago, and my face was a mess. I had some biopsies done, and that tumor was huge. And I come on to Matt, and I'm like, Matt, man, I just don't think this is the right time. People are going to be staring at my face. They're going to be like, what happened to this guy? And so I want people to really understand Matt is a really good guy.
You remember what I said? I was like, man, you look like you're in a lot of pain. I mean, we're going to talk about pain management. And you can see that on somebody's face, and you were on camera and you showed up on time. You didn't cancel. So, I mean, hats off to you too. But yeah, you were on there and you're like, hey man, I've had a couple of rough months. And I'm like, don't take this the wrong way, but you look at, why don't you get better and we'll do this again. So,
and because of that, I want people to know, I greatly appreciate that Matt gave me that chance, and just what a good person Matt is to have allowed me to have the time to heal and then be able to spread the message that I want. So thank you, Matt.
No thanks needed at all, man. Not at all. I'm just happy you're here, and thanks for sharing the message. It's been great getting to talk to you. Thanks for doing this.
My pleasure. I really enjoyed it. Thanks, Matt.
The Matt Feret Show, related content, publications, and MF Media LLC is in no way associated, endorsed, or authorized by any governmental agency, including the Social Security Administration, the Department of Health and Human Services, or the Centers for Medicare and Medicaid Services. The Matt Feret Show is in no way associated with, authorized, approved, endorsed, nor in any way affiliated with any company, trademark names, or other marks mentioned or referenced in or on The Matt Feret Show. Any such mention is for purpose of reference only. Any advice, generalized statistics, or opinions expressed are strictly those of the host and guests of The Matt Feret Show. Although every effort has been made to ensure the contents of The Matt Feret Show and related content are correct and complete, laws and regulations change quickly and often. The ideas and opinions expressed on The Matt Feret Show aren't meant to replace the sage advice of healthcare, insurance, financial planning, accounting, or legal professionals. You are responsible for your financial decisions. It is your sole responsibility to independently evaluate the accuracy, correctness, or completeness of the content, services, and products of, and associated with, The Matt Feret Show, MF Media LLC, and any related content or publications. The thoughts and opinions expressed on The Matt Feret Show are those of the host and The Matt Feret Show guests only, and are not the thoughts and opinions of any current or former employer of the host or guests of The Matt Feret Show, nor is The Matt Feret Show made by, on behalf of, or endorsed or approved by any current or former employer of the host or guests of The Matt Feret Show.